Good morning, ladies and gentlemen. Did I scare you? Did I scare you? Okay. I'm glad I did because I wanted to get your attention. You are most welcome to this USID Money SBCA Learning Dissemination meeting. It is indeed an honor and pleasure to have all of you, and thank you for keeping time. I think you should clap for yourselves. So my name is Andrew Magunda, and I work with the Money Project. I will be your MC, and I have a partner in crime, Mr. Armstrong Mukundane. He's just the other side. We will be hosting this. He's from SBCA. We do have these two projects working together on this event. So you will be hearing us speak about money. Money is Kampala Slum Maternal Newborn Health Project. And then we have SBCA, the Social and Behavior Change Activity. They are co-hosting this event. We have a host of our participants with you who are attending physically. And then we have so many other wonderful partners and participants joining virtually from all over the world. So we thank you for taking the time to participate in this event. I would like to first make a quick request that if you are seated in the back seats, that you would please kindly occupy the front seats. Let's start with that quick energizer. So just stand up and then come closer. You occupy the front seats. Thank you so much. All right, so are you a fan of public-private partnerships? If you're so, you're in the right place. If you're a fan of evidence-based programming, you're also in the right place. If you're a fan of implementation research, you're definitely in the right place. And obviously, if you're a fan of maternal and newborn health, please sit back because you are in the right place. You took the right decision to be here. You're in the right place at the right time. And in this room, we have several partners, stakeholders. I'm just going to briefly mention a few of them. If you hear me mention you, just wave to the people. We have Ministry of Health. When the people from Ministry of Health wave, please just also clap for them for recognition. Ministry of Health. KCCA. We have our wonderful providers, public and private providers, the midwives, the clinic officers, the community health workers. Please wave for us. We have our beneficiaries, the end users, the people that have benefited from the services. Development partners, they might wave online also.
Yes.
We have implementing partners. If you're an implementing partner, we have our wonderful USAID team. They could be online. The Money Project and SBCA teams and ICT incentives. Please wave to the people. They are very busy somewhere. And the PSI team. PSI teams. I see a wonderful country representative here and the rest of the members, Sarah and the like. So you're most welcome. We are going to take you through a journey of this project in a snapshot. We have been through a lot. We started formative research to understand and hear from our communities, their perspectives regarding healthcare. We did co-designing. We sat together and walked the journey to innovate interventions. We've implemented them in small doses. We are here to learn about that journey. So you're all most welcome. At this point, I would like to request Mr. Armstrong to take over from me and help us in the next segment. Thank you.
Thank you, Andrew Magunda, my co-MC today. Andrew has just given us a quick insight on where we are coming from and how we set off for the day. Without wasting much time, I think we are going to start by enlightening or providing the highlights or the objectives of this particular meeting so that we are all brought to speed on the same page as we roll. Ruth will be representing the USAID SBCA to share with us the objectives of this event. Over to you, Ruth.
Good morning, everyone. It's a pleasure to be here. My name is Ruth Musekura, and I'm the Deputy Chief of Party for USAID's Social Behavior Change activity. But before I share the objectives, I thought I would tell you briefly about USAID SPCA. We are a project, a 5-year project managed by Johns Hopkins University Center for Communication Programs and funded by USAID. And our role really is to provide technical assistance to the Ministry of Health and implementing partners in the area of social behavior change communication across a couple of health areas. So our reason for existence is to make a contribution towards the national health objectives by bringing communication into play. Family health happens to be one of our areas of focus, and that's the reason why we are part of this event. And just to mention, we are happy about the collaboration. Many thanks for accepting to collaborate with us. It's been a pleasure working with you. And we look forward to more opportunities to work together. I know it's been it's been a roller coaster, but it's a pleasure to see that we are here, and it looks like we're going to have a colorful event. So thank you so much for allowing us to be with you, as well as the Ministry of Health. So that said, I will walk you through the objectives for the day. Brian, are we going to project or? Okay, so how do I read them? Okay, so one of the objectives for our existence today here is to create a platform for family health implementing partners to learn about innovative mechanisms and tools for improving access to quality maternal and child health care for urban poor. And MANE has been actively involved in that area. They have a lot to share, and we will be listening to them. I'm sure I will pick something very, very helpful. Then the other reason for our presence here is to provide a forum for identifying, implementing partners' key insights and experiences in addressing behavior-related demand and supply-side barriers affecting access to family care for urban poor. So we're going to pick some experiences from what MANE and other implementing partners will share. The third one is for us, after having listened to these experiences, we don't want to just walk away. Would like to identify and document respective partners' interests and plans or prospects for replication. Normally when we have a learning event, we want to see what has worked, what hasn't worked, so that we can utilize that information within our work settings and sort of support replication and cascade of these interventions. Because if you have something exciting and you stash it under the table, then it never comes out. So it's very important to take it beyond the key people that have shared that information and cascade it further. Then, of course, lastly, we'll highlight the role of implementation research and human-centered designs in understanding how to bridge the no-do gap. So in summary, those are objectives, our reason for being here. We just have a day, and I'm hopeful we'll accomplish these objectives. That's the end of my brief sharing. Thank you so much. I'll hand it over to Armstrong.
Thank you very much, Ruth, for giving us those objectives. I believe that right now everybody has already made up their mind whether they're in the right place or not. Now, those who think they are not in the right place, this is the right time to make the right decision. But I believe we are all on the same page. Before I go to the next stage, I want to reiterate that we are still living in COVID times, so we need to be mindful and ensure that we are following the SOPs. Lest we are charged for promoting a behavior that we do not practice. So I'm going to request that we are always mindful at all times to ensure that we actually follow those SOPs. Now, at this point in time, I'm going to invite none other than our Director for Clinical Services or Curative Services, the Ministry of Health, Dr. Charles Soraro, to give us his opening remarks. I know he's passionate about maternal and child health as well, so certainly this is something that is closer to his heart. So, Dr. Oraro, we are happy to have you, and please step forward for the remarks.
Good morning. Morning. Oh, at least that's better. The Executive Director of Kampala City Authority, or his representative, the Minister of Health team, the leadership of Lubaga and Makindye divisions, the political leadership, the members of parliament, if they are available, representative of our funders, USAID, and other development partners, and specifically Dr. Christine Mugasha, representing the United States USAID in Uganda. I also want to acknowledge the USAID team in the US. Good morning, and I want to thank you for joining at this very early hour. Dr. Okello, I'm told, is out of the country, but I hope he's joined in. Officials from the private sector and the civil society organization, the community and opinion leaders, the members of the press and the academia, ladies and gentlemen. It gives me quite a pleasure to officiate this closing in ceremony that has significantly improved and informed the provision of maternal and newborn care in Kampala. When I did get a call from Dr. Ononge to come, I did indicate to him that I had quite a number of commitments, but I would make an effort to do what? To come. So it's really my pleasure to be here, because all of you know that the indices previously were presumed to be bad more at rural areas, but we are seeing that access, whereas the facilities are there, but these are not translate to what? Access. So actually we're seeing that the indicators are progressively poor for the urban poor. And so this project was definitely designed based on that aspect, to address that challenge. So today we meet here to see the key learning and achievements which this project has been able to bring out, and identify the appropriate interventions for improving access to quality maternal and newborn health care for the urban poor. Now we have 10 cities, but I think the lessons definitely which are learned here can be rolled to the rest of the other cities. The government of Uganda is working to ensure that every household in Uganda can access quality health care services regardless of the geographical locations. And so that's why you've seen government is looking at that for every sub-county there is a health center free. And one of the key components, service deliveries, which are done at that level, is provision of maternal services. So universal care is a key objective of Sustainable Development Goals, and it's critical that we address it. However, gaps remain in our health impact indicators, especially in the key sectors like maternal and child health. All of you are aware that whereas we have had really significant inroads and achievement in all the other health indicators, but we've not moved so much on the maternal and child health. And yet it's a proxy of the Capital Development Index of a country. So as a health sector, significant investment is still required in maternal mortality, because the maternal mortality fell only by 20% in the last 2 decades. And Uganda stands at 336 maternal deaths per 100,000 live births. And this is the 2016 Uganda Demographic Health Survey. However, we're observing a decline in this, that the institutional deliveries, the institutional MMR stands at about 90 to 100 live births. That's as the report of last year. So we are waiting for the Uganda Demographics Health Survey, which we know will probably begin at the end of this year, and next year we should be able to have those results. So it looks like we've definitely made what? Progress. And I'm sure that this project should have been contributed to part of that what? Part of that progress. All of us are aware that the leading causes of maternal mortality remains hemorrhage, contributing to over 45%, obstructed labor, and complications of abortions. And all of these are preventable causes of what? So this is really where we need to address the preventable causes of maternal death. I want to speak to all the 3 or 4 delays, but all of we need to take us into considerations. As you will see that some of them, the interventions actually were highlighted to address some of those delays. Our current neonatal mortality rate stands at 27 deaths per 100 live, per 1,000 live births, and this contributes to perinatal and neonatal deaths to overall burden of about 20%. So if we can be able to address the perinatal and maternal, natal and perinatal and neonatal death, then we would have been able to achieve much, because this is where the biggest number of babies are dying. All of you are aware that according to our Ramka Sharpen plan, it suggests that implementing the priority intervention package at scale will avert an additional 6,350 maternal deaths and over 30,000 newborn deaths. So the evidence is that we know. So I think the other aspect which you need to do is what we do and probably how we do it. I think those are the things now which we need, because all this is evidence-based and we know really how to address it. We acknowledge as government that there has been several investments in maternal and neonatal child in rural areas. However, but ensure that maternal mortality is heaviest among the lowest quintile in urban settings, with an estimated stillbirth rate of 43 newborn deaths per 1,000 live births. I think this goes to highlight what I had already mentioned. So today we close the Kampala Slum Neonatal Health Project, which has been addressing the challenges of maternal and newborn health in Kampala for improving access to quality health care for women and children. I must mention from this point that closing it does not mean actually that the problem also has been what? The challenge has been closed. Challenges do exist, but I think there are issues definitely which are going to continue even beyond the what? Beyond the project. The success of this project depended on a very strong multi-sectoral collaborations, and I really would want to thank our USAID development partners who supported it through the Ministry of Health, the Kampala Capital City Authority, both the technical and the political leadership, the technical support which you got from Population Services International, and the USAID Social Behavior Change Activity and Makerere University School of Public Health. I also must say that the private sector was critical in partnership in resourcing for these interventions, and we could appreciate them. I had thought there in the morning the clubs would have been much more stronger. But thank you very much. So in improving maternal and newborn care, The project introduced very smart innovations which were all premised on evidence, interventions, and these were scaled up by the stakeholders. The project harnessed the public-private health facility mix by supporting accreditation of 20 private facilities to provide quality and affordable maternal and newborn care services. And the key message to the members of the public is that this guaranteed quality for maternal and neonatal services and at a very affordable prices in these facilities. For example, a private facility in Lubaga, a private midwife-led facility, experienced growth in pregnancy, mothers attending antenatal by almost 141% after the start of these interventions. The facility also was able to reduce the prices of normal delivery for urban poor women from Uganda shillings 200, it's about $55.5, to about 120,000 Uganda shillings, which is about $33. The other aspect which this intervention was able to achieve was strengthening the efficiency of transportation and effectiveness of referral processes. As you know that the second delay is one of those major causes of maternal, preventable causes of maternal mortality. So it was able to establish the emergency call and dispatch center to coordinate interfacility transfer of emergency obstetric and newborn care. This ensured that the patient reached the facilities and they were given quality care timely. For example, 1,642 referrals have been made through the call and dispatch center, and over 85% of them were maternal emergencies. And you'll note that this really happened at the time when we had COVID. So you really be able to see that we had to be able to continue with other services amidst the COVID pandemic. In testing the feasibility and acceptability of the innovation to strengthen client-centered maternal care, we focus on extended antenatal services for busy mothers, including adolescent mothers, and also provide a respectable maternal and newborn care. So the project emphasized the use of evidence on decisions in referrals and supporting cases facility-led mentorships, including support supervision and on-site service provisions. So the affiliation of the private facilities with government facilities has boosted the community demand for services and motivates the private sector to focus. And I think this is what we should be able to sustain even beyond the project. So I'm looking at that some of the key lessons which are learned here will definitely be incorporated into the urban health policy, which is in the pipeline to be developed, so that we can be able to address that. We also need that the extended antenatal, the attendance between October 2020 to 2021, it grew from 0 to 1,242. So collectively, this innovation provided evidence to strategies to strengthen linkages between the public and the private facilities to increase access to quality maternal. And so this is a partnership which we think that we should be able to move forward. As a learning event today, we looked forward to understanding how these innovations worked in practice, what gaps remain, and probably you will share discussion what's required to consolidate this evidence to inform the defining policies and highlight the government of Uganda commitment on maternal and newborn health. We hope that the evidence shared today can be used to design appropriate intervention that use bottom-up approach in programming for ownership and sustainability. Because if the ownership is not there, then you won't be able to achieve this. But at the same time, we would want to avoid duplication so that we have efficient use of resources and ensuring that we leave nobody behind. The project is well aligned to the Ministry of Health, including the global financing facility, and the project evidence will accelerate our efforts toward designing the urban reproductive maternal health policy. So as a ministry, we want to congratulate the project stakeholders for providing these important insights into these effective approaches for improving maternal and newborn health care for urban poor, which can be scaled to other growing urban areas. So ladies and gentlemen, as I conclude, I want once again to thank USAID for supporting this important innovation for our health system. I also want to thank Kampala City Authority, both the technical and the political wing, and the teams from the two divisions for the commitment which you have shown during these interventions. I thank Population Services International that has worked tirelessly to coordinate the stakeholders and efforts and document the evidence arising from these key interventions. I further want to thank Makerere School of Public Health for being the leaders in bringing the life excellence in research and translate this into action. I want to thank the different divisions and departments at the Ministry of Health for showing commitments in this very unique health product in the market that's bringing sustainable efforts in reducing maternal and neonatal burden in Kampala. It's my pleasure, ladies and gentlemen, to officially open this workshop and wish you fruitful deliberations for God and our country. Thank you very much for listening.
Wow, wow, and yet we are just starting. Thank you so much, Dr. Olaro, for your opening remarks. Just to mention that Dr. Olaro has been heavily invested in this project right from the beginning. He is the one that flagged it off at inception and is here today. I think he deserves another round of applause. He's been struggling to make you clap, so I'm going to turn around a bit and ask you to give him some flowers, if you can. Just give him some flowers. Thank you so much, Dr. Olaro. Dr. Olaro didn't travel alone. I can see other members, and just like to recognize the presence of Dr. Jebi Wanyaye, the Commissioner for Emergency Medical Services. A round of applause. Thank you for coming. And in a special way, also recognize the presence of our country representative, Paul Mason. Please just wave to the people. You're most welcome. So just wanted to mention some housekeeping. We do have the ladies this side, places of convenience in the same room. And then this side we do have the gents. So please take note of that. Now, in the next segment, we are going to be listening to the man who has been almost at the helm of this intervention of USAID money. He is also the principal investigator of the project. He's one of the PIs. And as we all know, he is the A to Z of health in Kampala. So we would like to invite Dr. Daniel Okello, who is the Director of Public Health Services and Environment at Kampala Capital City Authority. He's joining in virtually on national duty from Senegal. So Dr. Okello, you're most welcome to give your opening remarks. Thank you.
To especially thank the Ministry of Health, the team from the Ministry of Health, Dr. Charles Olaro, thank you for those remarks. Dr. John Baptist Wanyaye, thank you for making time with your team. I would also like to thank the team from USAID, especially the team from Washington. I know it's quite very early morning there or late night, also thank you for making time to be here. In Senegal, I'm 3 hours back, so it's just coming to 7 a.m. But again, I know from the United States could be much, much earlier. The team from the private sector representation who is online, I can see Dr. Grace Chiwanuka is online. Dr. Grace, thank you for making time to being online. And also my colleagues from KCCA, I would like to thank you for supporting us through this journey, which started about 3 years ago. As I said, about 4 years ago, we met as a team, a very unique team from academia, team from the private sector, and team from government. And what brought us together was the issue of how can we be able to crack this nut of accessibility to maternal health services in the informal settlements. Traditionally, when you look at cities, you look at an area that shows progress, an area that shows opportunity. But not everybody has the chance to access that opportunity. And as a city leaders, you see that your biggest challenge is how can you have equity? Because when you look at Kampala, we could be on the hill in Naguru, but when you look down Naguru there, you see the informal settlements of either Kamocha and either Waisi. So how do you balance what people can be able to access a prosperity in Naguru and also try to create the opportunity for people to access that level of service as you look down in Kawempe or as you look down in Waisi? So that's when we came up and said, how can we increase the accessibility of health services in the informal settlements? But what came out clearly was the private sector seemed to be very, very dominant in the urban setting, and they are also there in the informal settlements. So as you go on today, you hear the story of how did we harness the power of the private sector as an opportunity for persons in informal settlement to access quality care. It may seem a paradox because the private sector may be associated with the pay for service, but again, you're saying the same people may not have access to the funds. So how are we able to balance the two? We are going to share our lessons as we move on that. The other that, as we move on to those bits, share the lessons on referrals. During our meetings, I had discussions both with Dr. Waiswa and the team from PSI. There was the issue of that each time you refer a patient, does the patient really or a mother, does the mother get the care that they deserve? And there was that term that kept on coming up of empty referrals. You bounce from one facility to another without any increase in care. So how can we be able to reduce on those empty referrals such that people go where they know they'll get better care? And again, we'll share about what we did to lessen on the empty referrals and to make sure that people did get the care that they were supposed to have. And it hasn't been a smooth journey. We were interrupted by COVID for 2 years. And during that time, one of our biggest challenges was how were we able to move the mothers who needed care during the lockdown. And that's when the call center came in. And within the call center, that's how we innovated, but that's how we also made partnerships along the way. So we'll share the partnerships that we did and how we managed to innovate in real time. So again, I would like to thank all the partners who worked with us. And I don't want to take so much of our time because I know the sharing is where we'll be able to tell you what we learned, what we thought should not be done, but what we thought can also be picked up and brought to scale. Lastly, this project was more or less premised on implementation research. We know it's not one of those things that has been prominent in the project mode, but many of us who are policymakers who are in office, we have unknowingly been doing implementation research. I always say that as a policymaker, your attention span tends to be very short. The financial year will start in July. By November, you're already planning for the next financial year. And you find that usually by March, your budget your policy statements should be in. And there are always issues that do arise, and you're always trying to get solutions to them. And in most cases, you may not have the time to document all what you have done, but as long as the problem is gone, you move on to the next one. So as part of implementation research is those things that we have done that we think are successful, we document and we'll share. And from this project, we hope this could be something that can be picked up in the next projects, such that, as someone says, when you write something down, I don't have to argue with you whether it's right or wrong because it's written down. But when you do not write something down, it tends to be my word against yours. So, ladies and gentlemen, thank you for making time, and I wish you successful deliberations today and also sharing and learning sessions. Thank you very much, Andrew and team.
Thank you very much, Dr. Daniel Okello, the PI for the project. That we're coming to a close. So, those were very beautiful words, and I think most sneak peeks into the program that has been running under money. So at this point in time, I want to welcome Dr. Raz Stevenson. Dr. Raz Stevenson is a senior advisor at USAID to give her remarks. First of all, we want to thank you for being early to attend this call at this time. So Dr. Raz, over to you.
Thank you so much. I hope my internet will enable me to give my remarks this morning. Good morning, everyone. Particularly, good morning to Dr. Alaro and the Ministry of Health team, Dr. Kello, KCCA, the Kampala Capital City Authority, all the wonderful healthcare providers, community partners, donors, MANE, SPCA, and the beautiful babies I've seen who are receiving nurturing care this morning in this meeting. It is wonderful to see that. Thank you. On behalf of USAID Uganda and of the Research and Policy Division in USAID's Global Health Office of Maternal and Child Health and Nutrition, we are very pleased to welcome you to this learning event. I apologize for not being in Kampala, and also acknowledge my colleague, Kuja Bennett, who has been working alongside you in this project, who has joined at 2:30 in the morning, Washington time. Welcome, Kuja. So really, I would like to start by saying that the USAID-funded Kampala Slum, Maternal and Newborn Health Project, which is also known as the MANE project, is based in Kampala and focuses on increasing access to critical maternal and newborn health services for the urban poor in the city, but in particular in Lubaga and Makindye districts, where at least half of the slum population in Kampala lives. As Dr. Okello described this morning, urban informal settings result in a confluence of hazards that compromise the health, nutritional, and mental health status of numerous groups of people and lead to urban poor and slum dwellers to suffer a vast array of undesirable health outcomes based on a host of socio-demographic, economic, and geographic factors. Informal settlements often contain a complex mix of public and private health providers and facilities, which pregnant women, new mothers, and their families must learn to navigate in order to meet their health needs and that of their newborn. As you would expect, the consequent gaps in access to critical services in these settings lead to higher maternal and neonatal mortality rates among the urban poor. The MANE project is an implementation research project that was co-designed with these factors in mind when, in 2018, it convened a key local stakeholders meeting, such as stakeholders like the municipal government, researchers, and public health practitioners, to address the challenges, harness the potential of the public and private mix of providers, and offer services that could, one, improve access to high-quality, affordable maternal and newborn health care for the urban poor, two, improve care seeking, and three, build a referral system for emergency transport with linkages to higher-level health facilities, just as Dr. Olaro mentioned this morning. And this indeed is a multi-sectoral collaboration. As part of today's session, you will hear about a number of key learnings emerging from this implementation research effort, and will encounter some of the innovative approaches devised to achieve the study's mission, including improving the quality of facility-based care through an accreditation model, and developing a digital Uber-like mobile app to improve access to emergency transportation services to address the delays spoken of, again, by Dr. Olaro this morning. Working in this setting presents a number of challenges, which were further complicated by the COVID-19 pandemic. We greatly appreciate our partnership with the Kampala City Council Authority and recognize that success in large part is due to the leadership of Dr. Daniel Okello, who serves as a co-investigator on this learning project and spoke right before me. I look forward to an exciting day of learning and adoption of the innovation that was developed and validated in Uganda. And with these short remarks, I would like to turn the session back over to Dr. Okello's team and Mane to begin the panel discussion. Welcome, everybody.
Thank you very much, Dr. Raz, for your remarks and for the commitment that USAID has really invested in this project. We have been working closely with the USAID Health Research Program, and they have been very helpful along the journey, and we must appreciate them. I think we need to give them another round of applause. Thank you so much, USAID, from American people. Now, we have an hour from now, our tea break, but before we go there, we now want to unpack the meal. What a better way to do that by inviting someone who has been almost at the fulcrum of the Money Project and who has seen it through the thick and thins. She is an OBS and GYNs icon in Uganda and internationally. Please join me to welcome Dr. Yvonne Kiza Mugerwa. Thank you so much.
Thank you very much for those kind words and for that introduction. And I would really, really like to thank all the people that have made such rich opening remarks to this meeting. As the lead of the MANE team, we would like also to thank you all for coming to this learning event. We are excited to have you. We are excited to have the opportunity to share what we have learned, and we really look forward to an engaging day. And we look forward to hearing what you would take away from here and what some of the learnings you would like to replicate where you work. So I also welcome the colleagues that are joining from different parts of the country, online and here. And please brace yourself for an exciting day of learning. So with those few remarks, I would like to welcome you to this panel discussion. It's going to be really, the objective is to help us think, why urban health? As you saw the theme, The theme of our invitation card was, and of this meeting, is innovating for improved maternal and newborn, improved urban maternal and newborn health care. And so I think many of you who have been in several of these meetings are saying, but now why urban maternal and newborn health care? What is special? And so we thought we would start by helping us understand why this focus, what are the issues, what is unique about urban maternal and newborn health care. And to help us understand, to walk us through this, we have a panel of very, very distinguished individuals in their own capacities. Some are joining us virtually and some physically, who will help us to think through these matters and highlight for us the things we need to keep in the backs of our minds and the things we need to think about in the 10 cities that Uganda now has to be able to ensure equitable access to maternal and newborn health care. So I'd like to invite the panel colleagues that are present physically to kindly join me up here. And as you come up, I will be making the introductions. I'll quickly go through the different profiles just so that you know the people that are talking to you, and then we'll quickly move into our panel. So Dr. Wanyaye, please, you're welcome. Dr. Mugambe, you're welcome. Mr. Ogwok, you are welcome. So, yes. So as they take their seats, I will be giving you a quick profile of who we have before us, so that we swing into the panel discussion fully aware of who is talking to us. On my immediate right, we have Mr. Patrick Ogwok. Patrick is a principal lab technologist and program manager for laboratory service delivery at the Department of National Health Laboratory and Diagnostic Services at the Ministry of Health. He represents a team that is behind the work at the Ministry of Health around improving quality of care and the work around accreditation, which I'm sure you'll be very keen to hear. Patrick, his current role is to plan, organize, and coordinate the implementation of various lab strengthening, system strengthening work, both in Uganda, but also supports a lot of accreditation work internationally. So he is representing that department from the Ministry of Health. He has worked in the public sector for over 15 years, right from hospital level, right up to the ministry where he now works. Next to him is Dr. John Baptist Wanyaye, who is the Commissioner for Health Services, Department of Emergency Medical Services at the Ministry of Health. He has served in several capacities through the different structures of the Ministry of Health Service in Uganda. So he served as a district health officer in Mbale district. He also was a program manager at the Infectious Disease Institute, an acting diocesan health coordinator of Tororo Diocese, and even medical officer at Katakwi General Hospital. So if you're talking what you feel at hospital level, if you're talking what you feel at district level, if you're talking what you feel as a programmer, he has felt all those things, and he's in a very good position to guide us. He holds a degree in medicine and surgery from Mbarara University, a Master's of Science in Health Services Management from Uganda Matters University, and allow me to say several other degrees and diplomas, which I will not go into now. But among Dr. Wanyaye's chief achievements is the development of the Emergency Health Services Policy and Strategic Plan that were approved by Cabinet on the 20th of September 2021. He oversaw the establishment of a responsive emergency medical services system that is regionally coordinated, and did a big deal to support the country in the management of the COVID-19 pandemic. Joining us online is Professor Peter Waiswa, who I think to many of us may not need a lot of introduction, but for those who might not know him, Professor Waiswa is he's an associate professor at Makerere University School of Public Health, and also a visiting researcher at Karolinska Institute in Sweden. He is also a member of the World Health Organization Advisory Board for Maternal and Newborn Health. He is co-principal investigator of the MONEY project, and he has also led many initiatives in the research area and also at community level to improve maternal and newborn health care. And as you know, he is the lead or the champion for the Makerere University Center of Excellence for Maternal and Newborn Health Care. He is widely published. You can just Google his name and you will see that he's widely published in this area. And we are privileged to have him on the panel. Dr. Okello Ayen Daniel, who has already spoken to us, is the Director for Public Health Services and Environment at Kampala City Council Authority. He is also co-principal investigator of the MONEY project. And Dr. Okello has keen interest in urban health, as you have probably all heard from even his opening remarks. And he has been employed at senior level in both public and private sector, in health services at hospital, regional level, and at citywide level. He was lead in the transformation of the health and environment services in the city of Kampala when the governance of the city was reformed in 2010 and continues to serve up to now. With those many words, I'm sure I have convinced you that these are the right people to talk to us about why think of urban health. So I will quickly take us through. We will now go into the actual panel discussion, and please feel free to type in whatever questions or concerns you may have about things that are emerging, and we'll have a short session at the end of the panel to receive questions and hopefully quickly answer them. So my first question will go to Professor Waiswa, who's joining us online. Professor Peter Waiswa, why is a special focus on urban health important, especially a special focus on urban maternal and newborn health? Please walk us through why you think that is important, what the issues are, and what you think we should be looking at as a country if we want to comprehensively tackle the issues that surround urban maternal and newborn health. Over to you, Professor Waiswa.
Thank you so much, Dr. Yvonne. I hope you can hear me. Sorry, my camera is not functioning. And greetings from Stockholm. I'm visiting Stockholm as of now. And all protocol are observed. I just wanted to say, last week, I was here with members of parliament from Jinja, one opposition, one ruling party, and then Dr. Tagola from Jinja Hospital, and a couple of people we visited the hospitals here in Stockholm, looking at newborn care. We also observed how Sweden actually takes care of every child from birth up to age 19. They actually initially kids are born, and then they are handed over to nurses and midwives who follow up these babies. It's a very interesting thing that we learned how urban centers here work. And we're going to do the same, actually, I think, in Jinja with the support of our partners. Now, many years ago, I think about 3 years ago, we started this project, MONEY. Actually, maybe I should have some, I was part of a group who said we should call this project MONEY because we started by asking the question, why should women be dying in the city? And at that time, I wrote an article in the newspaper, why should women be dying in the city? And I was sitting at Makerere University in Mulago Hospital and looking at the slums nearby, that why should we as people in the university be going to Luuka where I come from to study maternal health.